My name is Manohar Punjabi. I'm 63-year-old. Recently, I had went through a liver transplant surgery in King's Hospital, where they did my liver transplant. Basically, this liver problem started since last December 23, where I had gone through a normal clinic to check for some fever or something. And they did the blood test where they found something, hemoglobin had dropped. I was admitted to the American hospital where they treated me. They went through endoscopy and all. Going through a lot of tests, MRI, CT scan, PET scan, everything. They recommended me to go to the King's Hospital where they do the transplant and all. We found that Dr. Kaiser Raja, who was here.
Well, the story starts about 5 months ago when Mr. Manohar first saw me. He was a patient with long-standing diabetes. He was following up with his doctors. About a couple of years ago, he was diagnosed to have liver cirrhosis on ultrasound scans and blood tests. He was very stable. He had no issues to get concerned. He was told that he needs regular testing, and unfortunately in one of the tests he was suspected to have a small cancer. So patients who have cirrhosis like Mr. Manohar have a small risk of developing liver cancer. Fortunately, he was being followed up very well and the cancer was detected at an early stage.
And during this meeting, we started doing it, and where they suggested that I had to undergo liver transplant, and they'll put me under the list so I can get the donor maybe in 3 months, 4 months, 6 months, whatever it is. This started actually I got the call from King's Hospital that probably I have a donor, somebody we can go for the liver transplant immediately. And then on 19th, I had undergone through liver transplant in King's Hospital under Dr. Srinivasan and Dr. Rakesh Rai, who were the surgeons and anesthesia team and all the support staff, everybody. They were very helpful to me, and with the God blessings, the approvals came and the surgery went through on 19th.
Mr. Manohar contacted us regarding the treatment for the liver cancer. Liver cancer can be treated in many ways, but in his case, because he had underlying liver cirrhosis, which itself is an advanced disease, and on top of it, Mr. Manohar developed liver cancer, we suggested to him that he should have a liver transplant. So he understood the whole process very well. We were able to do a complete pre-trans evaluation, and incidentally, Mr. Manohar was also detected to have advanced heart disease just before the transplant. And we had to sort that out also. We had to put a cardiac stent to stabilize his condition. But thankfully, everything went well. Mr. Manohar had to wait for about 3 to 4 months for the transplant. Eventually, he got a very good liver. He had a liver transplant. And now it's about 1 month after transplant. He's doing really well. The transplanted liver is working very well. The cancer is completely cured. His diabetes is well under control. And I'm sure he'll continue to do well for many, many years.
It went so smoothly that when I got up and came back into senses also, absolutely there was no issues with the surgery or whatever it went through very smoothly with all the expert teams. I'm under the recovery and I'm doing fine. I'm going outside also, walking, doing my exercises regularly. I'm thankful to the King's Hospital for doing such a wonderful thing for me. It was a blessing. For God made everybody together, that time. It has been recovered so far, so good. It's everything fine. I find one of the best treatment I got. Though I had gone one of the major surgery in whole my life after 63 years. It was so smooth. Absolutely, I didn't get any kind of trouble or pains or anything. I never felt any kind of issues so far with the treatment. Once again, thanks to all the King's Hospital. Thanks to everybody and thanks to God for doing these things, arranging for me everything. And all came as angels that time.